So pelvic floor being the most important thing to do during pregnancy, because if you prep your pelvic floor for birth, it helps prevent so many injuries, and it's easier than pushing for hours and hours and hours and then creating injuries like pelvic organ prolapse or ending up having to have an emergency C-section. So what we're gonna talk about is breathing baby down and out and really conditioning your pelvic floor, preparing your body in order for baby to slide out and have a less constricted exit, if you will. So I'm excited that you're here learning this. I truly believe that if like every single woman did this, we would not have the joint replacements, the diapers that we see in our 60-year-old moms, and then that leads to them being in nursing homes and diapers and joint replacements and wheelchairs. Truly, if we take care of our core, starting from pregnancy and then having recovery afterwards, if your core is strong, then you take the pressure off your joints, you take the pressure off your bladder, and so you don't stress your bladder for the rest of your life, so you don't end up in diapers. But by the time we get to diapers and joint replacements, like, you're already at your last resorts, so there's not a lot we can do. Like, yes, you can get help and like you can have certain surgeries, but it's like, who wants that quality of life? And I really think so much of that goes back to taking care of our core, taking care of our pelvic floor during the pregnancy process and during postpartum. When I talk about the core, so we're gonna go over some anatomy. We'll go over some boring like body mechanic things just to be aware of right now during pregnancy. The more that you're aware of your body, the more that you can prevent injuries now. So we'll do some of that stuff. Then we'll talk about peeing and pooping, because that will help you get a little bit more control of your pelvic floor. So we're gonna go over how to pee and how to poop. We're gonna go over how to breathe baby down and out. So when you start experiencing contractions, you know how to move your pelvic floor, move your breath to help open everything up and ease the exit. So that's what we're gonna do. Sound good? Cool. All right, let's go through the core. We'll start with the core. So the core includes your diaphragm, which is this muscle underneath your ribcage. Your lungs sit on top of the diaphragm. So when you take a really deep breath in, like this, your diaphragm goes down, and then you have your pelvic floor at the bottom here. That's where your vagina is, that's where the anus is, that's where the urethra is, that's where the clitoris is. So that's the bottom of the core. This is the pelvic floor. And it controls all these functions. So if you have trouble orgasming, or you have pain with intercourse, or a lot of constipation, or you are leaking some urine, your pelvic floor is most likely affected. So something in the pelvic floor just isn't working quite right, and that's where pelvic floor therapy can really be beneficial. But that's the bottom of the core. So the top we have diaphragm, bottom we have pelvic floor, on the back side you have your butt, on the front side you have your lower abdominal muscles and your rectus abdominis and your core here, and then we have some back muscles. So that's the entirety of the core. So I just went over what the core was, but the neglected parts of the core is typically the pelvic floor. Like, you can find a lot of exercises online to do for like getting your core back after babies, or sometimes even prepping your core for delivery. But what is the missing link so much is usually the pelvic floor. And the reason I say this is because your pelvic floor has to do this. It has to be able to relax, has to be able to overstretch, and then it has to be able to contract. And regardless of whether you're pregnant or not pregnant, your pelvic floor is this force absorber. So every time I'm walking, or I'm picking my kids up, or doing anything like that, the pelvic floor is moving in this direction. But for most of us, our pelvic floors are constricted and tight and don't move a lot. So even if you've had 3 to 4 kids, a lot of times what ends up happening is that the pelvic floor actually tightens because of scar tissue, because of stress, and we don't ever really get that connection to the pelvic floor. This isn't something that we're taught in like 5th grade flash class, if you guys have that, where they teach the sex ed stuff. And we need that. Where you get all your strength from your pelvic floor is in the ability to open your pelvic floor. So the more that the pelvic floor can open and move, the harder it can contract, the stronger it is. For pregnancy, for preparing to get baby out of the birth canal, we need the pelvic floor to open. And a lot of times that's the hardest part. Most people have cemented, very tight pelvic floors, especially if we've never connected to this area. connect to this area, and we're gonna learn how to open these muscles. A lot of what we do here in the clinic, we use our birth preparation protocols, and we do a lot of manual therapy on the pelvic floor muscles themselves, helping them open, helping the pelvis balance so that baby can then descend with a lot less restriction and not having to work so hard to get out of the birth canal and work like through cement, if you will. So we'll learn everything of how to control pelvic floor today, but a lot of what is so beneficial is getting the hands-on work, getting the pelvic floor to get open, and sometimes that's hard to do with just our breath. But regardless, it is so good to start training now. Even if you're delivering in 2 weeks, starting to train this muscle now will be really important. So we'll go from there. Let me go into some anatomical changes and how they affect the pelvic floor. So when we're pregnant, our rib cages tend to expand. You might notice your bra sizes are starting to change a little bit. What happens is that as our rib cages expand, so baby can grow and make room, is our diaphragms expand as well, and so they actually get a little weaker. And so you have to train your breath during the pregnancy itself in order to keep that muscle really conditioned. And like I said, that's part of the core, and that's going to be a really important muscle to help move baby down. So let's just actually start to train this now. So we're going to do our first breath together. You're going to have a hand on the belly and a hand on the chest. And you can go feet flat, maybe about 2 fist widths between your knees, so your hips are in their sockets. Hand on belly, hand on chest. I want you to take a nice deep breath into the hand on the belly. Deep breath in, exhale and let it go. When you inhale through your nose, if that feels okay for you, feel that air coming into belly. Try not to let the chest move too much. Exhale and let it go. So that is what we're calling a diaphragmatic breath. Online or on social media, you might see different types of breathing that it's like, do more 360 breathing or breathe into your rib cage. And that can be really great and effective, but when we're talking about opening the pelvic floor itself and then like using our breath to push baby down and out, we want to use a diaphragmatic approach, so using that belly breathing. The other type of breathing is called lateral costal breathing, and that's more like breathing out here, like into our ribs, and you're not going to get as much descent from the diaphragm down onto the uterus. Does that make sense? So that's a really important just thing to start practicing. I would do that 5 minutes every night before you fall asleep. Hand on belly, hand on chest, 5 minutes into the belly. It's also relaxing, so it's going to kick on your parasympathetic nervous system and keep you in a more relaxed state. This is the type of breathing that the minute you start experiencing Braxton Hicks contractions, the minute you experience like labor contractions, going to this type of breath pattern is not only going to help bring baby down because you're using that diaphragm and pushing down on the top of the uterus, but it's also going to keep you relaxed. And if a parasympathetic response is our bodies being relaxed. When we're stressed, we're in that fight or flight sympathetic response. It's really hard to cascade into full labor when we're in that in that fight or flight response. So keeping our bodies as relaxed as possible, using the breath, is so essential the minute that you cascade into labor or you start labor process. It's one of the things that, like, if you start laboring at home and you're like, but I gotta get to the hospital, like, keep lights out, keep sunglasses on, keep your body in that like most relaxed state as possible, especially if this is your first baby. It's exciting, right? It's exciting to get the contractions. It's exciting to start to feel it and be like, oh, or have your water break. But the reality is it could be 30 hours, it could be 48 hours. So keeping your body in that fully relaxed state, using this breath pattern to help keep the body in the relaxed state, is going to be super essential at allowing you to cascade into labor. I always tell people when you are in like those early phases of labor, or even if you're getting to the hospital, especially if hospitals cause you like any anxiety, like actually who feels relaxed in a hospital, unless you work there maybe. But you know, just to like visualize that this is your spa day, or whatever it is for you. Maybe it's like you want, to like pretend you're in the forest and, you're just like basking in the forest. And like pretend your hospital room is that, and just mentally go there, have that safe space, so that, again, your body can just be in that parasympathetic, relaxed state. If you have in-laws or parents that want to be in the room with you and you are like, and they trigger you, like that's a no-go, because that's gonna stop this baby from coming right out, Yeah.
So question, does this type of breathing help sustain the labor and get it towards
100%.
delivery?
100%, yeah.
Okay.
Yeah, so I have this amazing story. So we just had a patient just email this a couple days ago, and she had a super long induction. Her first baby had a lot of tearing, lots of pushing, ended up being like a 40-hour birth, and lots of trauma. Ends up getting pregnant again, comes here during her pregnancy because she did not want to have that experience. She ended up having to get induced, I can't remember why, and just had 7 hours of breathing like this, breathe baby out in 15 minutes when she was fully dilated. And like, it was like, that's the difference, right? It could have been another 40-hour induction process, but she had the skills to breathe baby down. She had a really open pelvis from doing a lot of the hands-on work, but it's truly like that breath pattern, if you can just engage in it. And like the worst part, I teach at Swedish, so I teach the OB nurses at Swedish. Every quarter I go and I onboard the new nurses, and I teach them this type of breathing and how to connect it to your pelvic floor, because all of the nurses and all of the doctors, even if they've sat in my training, I've heard that there's power dynamics that happen, they will tell you, hold your breath and push. And they'll tell you, like,
That's what I
and they'll
was
cue that,
Yeah.
so they'll say, okay, just hold your breath and bear down with all your might. But the reality is, even if you get an epidural, if you stay locked in on this type of breathing, a lot of our clients get epidurals and can feel themselves breathe baby out. And so you still have full control of that. Where was I going with that? Oh, but like, it's hard when someone's yelling in your face to hold your breath and push, and you be like, no, I'm gonna breathe baby out, and you're in a ton of discomfort with your legs spread open. Like, it's hard not to take that authority from the medical professional, but that's why it's like, the more empowered you are, the more you know about your breath, the more you can connect to it, the better everything is. Yeah.
So you're saying, because I missed the first few minutes,
Yeah.
This is like a totally different paradigm and school of thought. It's like basically the opposite of what most medical personnel are teaching.
Yeah.
I've actually had a few kids, and I've always been told, like, hold my breath and bear down and hold my breath as long as I can. And I used visualization with it, so it was still like more holistic, but it wasn't, it was like, there was no active breathing involved.
Yeah.
Unless it was between contractions.
So research shows that the more you use Valsalva pushing, so holding your breath, you're going to tear more, you're going to have worse prolapse. That's where the organs start to come down through the vagina. I have a prolapse myself because I did that same type of pushing. My first baby, and my pelvic floor was cement, so I was like pushing through cement. And even though I was a pelvic floor petite, you'll read it in the book. You should. We'll give you, if a book wasn't on your chairs, we'll give you a book before you leave. Don't leave without it, because I talk through a lot of that shift. I hate that you say that, because I feel like the paradigm's changing, but it's just I'm so biased because I'm in this every day, right?
Yeah.
So I do feel like it's shifting, and I do think depending on where you deliver, people are supporting. Yeah, it just depends.
And I mean, I loved my birth experiences, but it was always.
It's funny because
they'd even say, like, visualize yourself,
Yeah.
I visualize myself like swimming and holding my breath, But
yeah. So we keep breathing through that, and then also, just a side note, people ask all the time, like, oh, what position should I breathe in? Honestly, it shouldn't matter what position you deliver in. You can deliver on your back, you can deliver on your side, you can deliver in squatting. If your pelvic floor is conditioned enough to open, then you can have your baby in any position. You just have to learn how to get that control. And that's one of the things we do with our manual therapy, is making sure that you have that opening, and then we put you in different positions to see where do you have the best opening. So if you want to deliver without an epidural, what are your best positions? And then we do epidural safe positions if you end up getting an epidural on like where you have the most control. The more in tune you get with your pelvic floor, the better connection you're going to have, even if you do have an epidural. Like I said, so many of our clients have epidurals, and they're able to feel that breathing and really being able to breathe baby out. Okay, so I sidetracked it there, but let me get back to okay. So diaphragm. So we talked about the diaphragm and how that changes, and so doing that 5 minutes a day is going to be essential. We're going to connect that breath, that diaphragm, to your pelvic floor in just a little bit here, but I just wanted you to get that idea. The next thing I want you to know is that the pelvis, when you're pregnant, this can start as early as 6 weeks. You get an influx of relaxin. So that's that hormone that causes the ligamentous laxity. So it causes your joints to be more flexible. When your joints are more flexible, you're more susceptible to injury. What also happens is that your pelvic floor does an amazing job of squeezing and holding you together even tighter, which is not great for preparing for birth, but it is good to keep you functional during the rest of your pregnancy. So it's a little bit of a counterbalance, but that's why also getting some pelvic floor work done can be so beneficial. But equally, that's why every single night, you know your pelvic floor is tightening through the day, take some deep breaths, breathe into that pelvic floor, and that will help open things up. And again, don't feel, a lot of people feel that if they are opening their pelvic floor, they're gonna leak pee, it's not gonna feel as good for sexual intimacy. It's the complete opposite. The more that you can open your pelvic floor, the more blood flow you get to your pelvic floor. When the pelvic floor is constricted and tight, it ends up turning to a consistency of beef jerky, and I'm sorry if that grosses you out, but it loses its blood flow. So it just becomes a hardened muscle. This is exactly what we feel in the clinic when we're doing pelvic floor exams initially. And so our goal then is to turn that beef jerky into more chicken breast and make it feel like it's like a healthy, hydrated muscle. When it's a healthy, hydrated muscle, even if you tear during childbirth and it's healthy and hydrated, it heals like this. Like it is a non-issue. But when you tear a muscle that is completely dehydrated and not healthy, it's a long time to heal that muscle. And so that's one of the reasons why it's like, get that muscle as healthy as possible now, start breathing into the pelvic floor, get some pelvic floor work done so you can truly get that hydration and get the health in the muscle. And then your baby doesn't have to work so hard to get through the birth canal. So it's a win-win for everybody. I'm like, should I share a possible sad story? No, I'll just keep going. I have to. Our other client recently, the doctor said they were like, your baby wasn't gonna make it if you didn't get that baby out in 2 minutes, and she did, and like she barely pushed, but it was like, and they were shocked because this was her first baby, but her pelvic floor was like butter, and they were like, this is either right now baby comes out and you have one chance, or you're doing a C-section and hoping we can save your baby. Baby ended up being fine, and like it was okay, had some time in the NICU, but ended up being really fine, and is thriving. But it was just one of those things. It's like conditioning your pelvic floor, conditioning your body, and knowing how to help baby get out can really be like substantially good, okay? It's so preventative. So do I wish insurance covered this? Absolutely I do. But the fact is, like, we're just not a preventative healthcare system, unfortunately. But yes.
That was a quick question leading into it. Does that help the baby shift and position the way it needs to?
Yes.
By doing this type of breathing?
Yes. Yeah, 100%. The more the pelvic floor can open, the more space baby has to be in the right position, to be head down.
Okay.
So that can make a big difference. Does it always work? No. I would say our C-section rate was really low last year, but we probably had about 4 breech deliveries. And when they were breached, no one delivers breech babies here vaginally, so they ended up having to be C-sections.
Mm-hmm.
But it's a very small amount compared to the over 100 births that we had last year. So, but for the most part, yes, creating space. The other really cool thing is for one of the doctors in the area told our PT who's been in on some of the C-sections, and she said to our PT, she's like, I didn't even have to like wiggle it. A lot of times when you get a C-section, they're like cranking the baby out because it's like a hard shifting process, which is also super hard on the body. But they've noticed that when they're seeing our clients with like conditioned pelvic floors, and even if the baby is breaching in a weird spot, they're not having to work baby out because there's just more space. So the C-section recovery is that much easier because you're not having to manipulate the baby out. Now we're obviously wanting vaginal deliveries and that's the goal, but it's like amazing how much prepping that pelvic floor improves the recovery because there's more space to even get the baby out from the belly. So that's pretty cool. Yeah.
And are you finding that there's more success with turning babies
Yes.
from the breached position?
Yeah. Yeah. So we
That
do a
women
lot of
have.
spinning babies too. And
Yay!
yeah. Love that.
Yeah.
Cool. Okay, so those are the pelvic changes, and that's kind of why, like, another reason why pelvic floor can get really constricted and tight during pregnancy. Then you have your core muscles, and as our bellies get bigger, a lot of times we'll end up with a diastasis. So that's where these like 2 6-pack ab muscles will start to split open, and when that happens, what you have this linea alba, and there becomes what sometimes when people feel like a hole in their stomach. And so that's called a diastasis recti. Our goal is to prevent, everyone's gonna have it. The research shows that everybody ends up having a diastasis by 38 weeks. You wanna not have it be so big that it doesn't just recoil after childbirth. The one muscle, we're gonna do this together, so if you guys wanna stand up. The one muscle that helps prevent that diastasis, that helps prevent the spreading here is called your transverse abdominis muscle. Have you guys heard of this muscle? Okay, so it's that lower ab muscle. So if I let my belly just kind of like relax and hang out here, and then I tighten my lower abs, if I do a SH sound of shh, you'll see, did you see that elevation there? So you should feel this in your body. So if you put your hands right on side, like right by your hip bones, yep, right in there, let your belly kind of hang, and now whole baby up and in with that muscle. Try not to squeeze your pelvic floor when you do this, which is definitely a challenge. And you should feel a firming and a lifting under your fingers. Nothing should feel like it's bulging or coming out. If you hold that for 10 seconds, 10 times, do it before you're breathing, that is just a great way to keep that muscle strong during the pregnancy itself. That'll be preventative for that diastasis. So it's just something to keep in mind. Sound good? So that's your transverse abdominis contraction. 10 seconds, 10 times. The most boring exercise, the most effective. And do this postpartum. If you get this muscle going postpartum, but honestly, if you've kept it going during pregnancy, when you're just kind of a bag of bones postpartum, getting that muscle to turn on is gonna help restore your abdominal wall and bring things back together. It's more essential than doing any exercise or workout class. Cool. Okay, that's your transverse abdominis. Keep moving. Okay. Questions so far?
Another
Yes.
question.
Yeah, please.
So,
Yeah, this is so good.
what I'm feeling over the past week now, I'm 30
Yeah.
weeks.
Yeah.
Baby is like creating all this nerve sensation across my sacrum. Or
Yeah.
was this, that region, all the way around the pelvic floor. Is that normal? Like to start getting those sensations now?
Normal. It's very common.
Okay.
But I don't think any pain in pregnancy is ever normal, even though providers might tell you that. And I would say that this would be a great sign to get pelvic floor work done, because you don't want that. The more that you feel tension in your sacrum, or if you feel pain in your pubic bone, or you feel pain between your legs, then you're gonna have a more constricted pelvic floor, and things are gonna be tighter. So baby's gonna have a harder time getting through. And so the more that you can help those muscles open up, and doing some hip stretches too. I have stretches in that book. So there's like a chapter for low back pain. Check out that chapter for low back pain. And I have stretches associated with helping that area. But also I would, if you can make it work, I would make it work to get some pelvic floor work done, because that will help straighten the chute, if you will. What ends up happening, I'll just tell you from a clinical perspective. So when the pelvic floor is constricted and tight, what ends up happening, a lot of times people will do perineal stretching. Have you guys heard of that? Where you stretch just the vaginal opening, kind of like pull it, stretch it. It's not supported in the research, and I because it's supposed to prevent tearing. The only reason I think it's not supported in the research is because you're just dealing with the first layer of the pelvic floor, and the pelvic floor is 3 layers. Most our tightness is actually in this 3rd layer of the pelvic floor. And what ends up happening is the vagina is like this chute, okay? So the baby has to come through this canal, right? The chute has to open. What happens with this 3rd layer, if I was to insert a finger, is that the 3rd layer tends to get really elevated and tight and creates this kink in the vaginal canal. We have to open that kink so baby can get through and have a straight chute. So you'll have a lot of C-sections happen because baby didn't descend into the birth canal or cervix couldn't fully dilate. And a lot of times I have no evidence. I think it has to do with how much elevation and restriction we end up seeing in that 3rd layer of the pelvic floor. It's just because that pelvic floor hasn't been taught to open. Reality is most women have constricted pelvic floors unless we've been taught to control this area. These are private parts in our society. We're usually taught to cover them up, don't connect to them, don't touch them, and that creates a whole paradigm of us not knowing anything about our vaginas. And so it's not ideal by any means. And also they have studies where like they'll put electrodes on women's vaginas or like around their perineums, and they'll have them walk down a dark alley, and their pelvic floors immediately go into constriction. They do not relax afterwards. Your body stays in that state, and it's because we don't learn how to unhook our pelvic floors. And so it's just an interesting phenomenon, and it's important that we learn to connect to this area, and that's what we're gonna do. I'm gonna keep moving. I keep tangenting, I'm sorry. Let's do a couple adaptations just to consider. The more that you can keep your bodies pain-free during your pregnancy, the less restriction you're gonna have in your pelvic floor, so the more motion you'll have, the more opening you'll have, easier baby's gonna come out. Number 1 way people give themselves a diastasis during pregnancy is by leaning onto the couch, just simply relaxing onto the couch like this. So the way to do it is when you lean back onto the couch, engage your lower abs, engage that lower ab muscle, exhale your air, so you like decrease the pressure in the belly. So you're gonna exhale, and then use your hands to lower you back into the couch. So this isn't a great couch, right? But so it would look like this sometimes, because a lot of people will just flop on the couch, lean back, and that's honestly how I see the most ruptures of the linea alba. And so you're here, you sit down, use your hands, engage that lower ab, exhale, and make your arms do the work. Okay? Same thing goes for getting out of that couch. Make your arms do the work and push yourself forward. Yes, you're not going to be using your abs, but you don't need to use your abs. They're at a very weak and disadvantaged point. The ab exercise that I showed you earlier, that's how you keep your abs strong. Okay? So the crunching part needs to be avoided. And, crunches have their point, and we can get you back there postpartum. But while the abdominal wall is so thin and so stretched, you just want to respect the integrity and not stress those muscles in that way. I'm going to just say, it's not like hit or miss, and if you told me you were this diehard CrossFit athlete and you wanted to be doing that, we would find a way to make that work for your body, but you should definitely work with someone to make sure that you're not creating any more problems or dysfunctions. Does that sound okay? A few other things to just keep in mind is, there's a little fly on the ground. Great. We have a lot of plants in this office, so sometimes we get some flies. Okay, when you get into your bed at night, the best thing to do is use your hands to lay on your side, and then if you're gonna go to your back or go to the other side, straighten a leg, and then use this leg or this heel to roll you to your back, and then you can, same thing to go to the other side, use your arms and roll here, engaging that lower abdominal muscle as you're moving. I'm gonna roll back to the side, straighten the leg, push through the heel, engage the lower abs, and roll to the side. Train yourself to do that. You want to avoid like crunching out of bed.
Yeah, how about getting out?
Getting out of bed would be lower the legs off the table or the bed, and then push your body up and let them drop, just so you avoid that crunch. And do that for like 6 months postpartum. Just pretend like you're still pregnant and move like that in bed. just so your abdominals can really come back together. I don't mean to scare you. Your face is like looking scary.
No, I'm taking it all in.
Okay.
Because otherwise I get stitches.
Oh.
I do that, and it's
Yeah.
and the round ligament pain.
Yes.
Because I kind of like to split my legs around when I get out of bed.
And it's because it's stressing those ligaments. And so you need some and we all need pelvic floor work. I still get pelvic floor work once a month at least. So just here to keep it working for me, right? Cool. Okay, let's go into time-wise. I'm gonna keep moving. So I guess that's the only body mechanic stuff I'm gonna talk about, but there's more in the book too. And again, there's a lot of self-treatment. So if you're having low back pain or SI pain, so pain on one side, or if you're having pubic symphysis pain, or you're getting the pain where you feel like there's like a knife inside your vagina, there's ways to fix yourself in the book. So definitely use that as a resource. Okay, let's work on connecting to our pelvic floors right now. So we're gonna go back to that breath pattern. I have to tell you one more thing, so sorry, because this is gonna get you a better connection to your pelvic floor. When you sit down, this is a little weird, but just bear with me here. When you sit down, so whether you're sitting at a work desk, or even on your couch, or even in your car, what I want you to do, this is gonna help unload the pelvic floor, take some of the stress off, is I want you sitting on your sit bones. So in order to get you on your sit bones, you stick your butt back, you lift a cheek and you lift a cheek, and then you sit down. So then you should feel like you're on your sit bones. Let's all try it together. You don't have to maybe do this in public per se, but who cares? I do it in public. I mean, I don't care anymore though. Okay, so yeah, now lift your cheeks, and you're gonna have to get your glutes like. You're gonna probably have a lot of tightness back here, so it might not be as easy to lift them, but the more you do it, the easier it gets. And then you lift it, and you stick it out, and you sit down. Jeans are a little hard. I'm having a hard time getting mine to lift. And then once you sit down, lift the cheek again, and really you should start to feel like you're kind of on your sit bone. Do you feel that at all? Mm-hmm. And then, ideally, you'd have a pillow behind you. I have another pillow here. Sorry.
Oh, you're fine.
Okay, so if we stuck your cheeks out and we allow that to come back, then all we would do is stick something behind your back, and you should feel like you don't have to hold sitting up nice and tall. You should feel like you kind of like melt into it, and now you're just sitting on your sit bones. Do you feel that? Mm-hmm. So you're here, and you just if like I need a pillow back here too, but do you have a pillow?
Yes. No, I do.
Oh, okay. It's a little squishy. Yeah.
Can you
So-
explain the rationale behind that?
Yeah, so the more we can get you right on your sit bones, the less stress it's going to be in the pelvic floor. When we're sitting in our normal like kind of postures like this, that's going to put the pelvic floor in a really tightened position. Also, you're going to have a little bit better connection breathing in this position, and this is going to be easier on your pelvis. So the more that we like cross our legs, or we're just sitting on one side than the other, with all the relaxin and progesterone in your bodies that are causing that increase in flexibility, that's going to create more pain in the joint, in like the SI joint or in the pubic symphysis itself. So the more that you can sit on the sit bones with your knees at least fist width apart, is going to be a better situation for your pelvic floor, but also for your joints. That's my rationale. Okay, now let's connect. Whew, getting distracted all the time. Okay, hands on chest, hands on belly. We're going to take a really nice deep breath into our pelvic floor. What I want you to feel is the vagina opening. Exhale. You might feel the vagina close. We're going to do that again. Inhale. If your vagina was a rosebud, you are trying to blossom the rosebud so we can see every single petal of that flower. Exhale, you might feel some closure. If you're like, lady, I feel absolutely nothing, and you need to see a pelvic floor physical therapist. But also, if you were at home and doing this, you could, if you felt comfortable touching your own body, you could stick a finger right inside the vaginal canal and see if you can feel that opening. This is imperative that you get that connection, because if you don't have that connection, you will be holding your breath and bearing down and pushing. That's just how it's going to go if you're not able to get the control of the opening. So that's why it's really good to get that control. Where am I going with this? Some people have better connection to their anus. So we just cued going to the vagina. You might feel like you can connect better and get more opening from the anus. So we're gonna do another breath, and I'm gonna cue opening your anus. So you're here, deep breath into belly. Inhale, feel your anus opening, almost as if you were gonna pass gas. Total safe space to do so. Sorry everyone, but we're letting things open. On the exhale, you will maybe feel some recoil. So you inhale, diaphragm goes into belly, pelvic floor should open. Exhale and let it go. This is the breath pattern when you're in labor to breathe baby down. When you're inhaling like this, your diaphragm is pushing down on the top of that uterus. You have your uterus. The uterus is actually what pushes baby out. We don't push the baby out. So we want to open so that the uterus can do its job. When we're cued to hold our breath and push, it's because we're not letting the uterus do its job. And really, like, even if we were out of it, sedated, like, the uterus can get the baby out. We just have to be totally open and relaxed for it. And so that's where this breath pattern facilitates the uterus to do its job. But also, when you're using the breath like that, what it's doing is every inhale is pushing down on the top of the uterus, giving that uterus a little boost, giving that baby a little boost to go down lower and lower and lower. So say you're in labor and you get an epidural, instead of getting on your phone and being like, sweet, I'm not in pain anymore, like, just lock into this type of breathing. The more you practice now, the better control you're gonna have then. And just find your happy space with this breathing. And try to clear your brain or go to some special magical place, because it could be 30 hours of locking into this breathing. But the more opening you have of your pelvis itself, the better you're gonna have control of breathing baby out. I wanna go into peeing and pooping, because that will help you gauge a little bit more in having control of that pelvic floor. So let's do pooping first. So when you get the urge to poop, how we poop is how we breathe baby out, okay? So they're one and the same. Every single bowel movement you have from today forward, you're visualizing your poop being your baby's head, okay? I know they're different holes, but it's same mechanics, and the brain, if you can start mapping, like, oh, that's my baby's head, the brain's gonna be like, oh, baby's head, I've done this before, even if it's your first birth. And so it's just like giving the brain like, oh, I know this feeling, I know everything about this move. And so that's why we're gonna start breathing our poop out. This is not something that you stop doing, by the way. So you're gonna teach your kids how to poop like this, you're gonna teach your partners how to poop like this, you're gonna teach everyone in your life how to poop like this if you're comfortable talking about it. And the reason for this is because as females, we have to keep our organs inside of our bodies for the rest of our lives. We want to prevent having hemorrhoids, we want to prevent having anal fissures, we want to prevent constipation. When we are pushing our poop out, we are pushing our organs down and out. When we're pushing babies out, we're pushing our organs down and out. That doesn't fare well over time. The majority of people we see have pelvic organ prolapse. So they have some degree of their organs coming down through their vaginas, and yes, there is a lot we can do to keep that at bay, but the more that you're prepped for this childbirth experience, the more that you can breathe the baby out, those organs stay in their places and like have a much better chance at survival inside the vagina than outside. So that's just my sales pitch of why you need to keep breathing this way and pooping this way. But okay, so we're pooping. You get the urge to poop. You always want to go poop within 15 minutes of that urge. I know that's not always feasible, but do your best for that. The more that you hold your poop in and ignore those cues, the more those cues go away and the more the colon enlarges. And so so that can lead to constipation, symptoms like IBS. It can lead to passing gas, fecal leakage. And so when you get the urge to poop, go poop, okay? When you need to go poop, you're gonna sit down on the toilet. You're gonna spread your feet apart, feet flat on the floor. You're gonna lean forward as long as this feels okay on your body. As your body changes sizes, it might not feel good. So just make room. If it doesn't feel good, it's counterproductive. Because if this is painful at all, then this is gonna create tightness in your pelvic floor. We want opening of the pelvic floor. So ideally, you're in this position. You could also use a squatty potty. You guys know those, the stools? So what this is doing for the rectum is it's straightening the chute of the rectum. This has nothing to do with the vagina. This isn't, when you are delivering, it's not the same, okay? These are different kinks in the canals. So just for pooping, when you wanna lean forward, and that's gonna straighten the chute for the poop, okay? So that's where the leaning forward. Now again, if this causes back pain or you feel more pressure, then it's not the move, and you should, figure out leaning backwards maybe. So I'm saying it as for most people, but if it doesn't work in your body, that's not bad or wrong or anything like that. So when you're here, you're breathing, you get on the toilet, we're in this position, or you have the squatty potty, we're gonna do 3 deep belly breaths. So most of the time when we get to the toilet, we just push and get the poop out. We're not gonna do that anymore. This takes discipline to poop like this, especially when there's kids around, because you're like, I just gotta poop and go, okay? But try your best to get in this position, let your belly relax, let everything relax. You guys can do this with me. We'll just pretend poop. And when you're here, you're gonna deep breath into belly, let the belly soften, really use that diaphragmatic breath. You can imagine your anus opening here. Exhale, let it go. When the diaphragm goes down into the belly, it's massaging the colon, allowing you to get more peristalsis, so it's gonna push that poop along. You're gonna deep breath in again. And at the top of the 3rd inhale, if the poop has not come out, that's when you can initiate bearing down and pushing. So you're inhaling, top of the 3rd inhale, hold the air, begin to initiate pushing the air out, or pushing the poop out as you are breathing. Do not hold your breath. So you keep your glottis open, keep your throat open, and push here. Sound good? This is the way to poop. It will change your life. So start pooping like this. And I like to say just add the baby's head in there. I know it's weird and it's separate, but it just gives that visualization. So, and now you have, however, you have 10 weeks till you get this baby out. That's at least, hopefully 40 poops. Or wait, I don't know where my math was. Never mind. It's not working. But you get the point. It's a lot of poops. And so just use those as conditioning and use that as, okay, this is how the baby's gonna come through. Questions on that? Okay, a quick little rendition on peeing. It's not that complicated. But when you pee, because you have more pressure down on your bladder right now, and the bladder can shift a little bit in the vaginal canal, when you pee, definitely sit fully on the toilet, no squatting to pee. Most people can't relax their pelvic floor in a squatted position. Take some breaths to relax pelvic floor. So do the deep breath in, open pelvic floor, allow the stream to start, allow the stream to fully end. Once the stream has ended, then you're gonna shake it out. You're gonna lean forward, lean backwards, you're gonna go side to side, and you're just gonna shake the bladder out. It's gonna help you get more empty. This will also help you sleep more through the night, because if you can get the more fully empty, the bladder never fully empties, just so you know, whether you're pregnant or not. There's always residual volume in the bladder. But without that said, the more that's left over, the more acidic it becomes, and that causes more bladder spasms, which then makes you have to go a lot more frequently. So the more you can get out, the less you're gonna have to go. If you're finding yourself going more than every 2 to 3 hours, that's coming probably from your pelvic floor, and that should be a cue that you're getting pelvic floor work done. Or if you're having any leakage at all, because that's restriction in the pelvic floor that is then causing you to get these false urges when your bladder's not actually full. Does that make sense? So just like a side note of to get some work done. Okay, so that was peeing and pooping. Did I get it all? I have a little thing on orgasm. We're gonna just talk about it. Orgasm is great to partake in as far as conditioning for birth, because it's utilizing the pelvic floor muscles. And it also, the reason I like it is because it stimulates the uterus. So it's never going to put you into labor, but it does stimulate contractions. So when you have an orgasm, you get contractions in the uterus, whether you're pregnant or not. And just so you know, most people just have clitoral orgasms. That's what's normal. Most people don't have penetrative orgasms. So if you're getting clitoral orgasms, that there's a reflex that goes up to the uterus that will create these little contractions. So I feel like it's a little cheat to start getting your uterus to practice having these little contractions without sending you into labor. If orgasm is painful, uncomfortable, hard to achieve, or you have to work really hard to get it, then that's another sign that pelvic floor is probably not in the best of shape. The clitoris is infused with pelvic floor muscles. If the pelvic floor is really tight, then it's already probably contracted, so it makes it really hard to cascade into a climax. So that you have to have relaxation to be able to cascade into a climax of an orgasm. So just a little side note. Moving forward. Okay. Let's go into breathing baby down and out. If I'm gonna just say this out loud. A couple indications of when to absolutely get pelvic floor therapy. I think everyone should have it during pregnancy for the mere fact of just protecting your body so baby doesn't cause too much damage. And the more conditioned it is, the easier it is to recover. There's of course still recovery because you just grew a human for 10 months. But it does, people just do so much better when their core is already conditioned going into the birth. But if you have lower back pain, neck pain, mid-back pain, get pelvic floor work done. It is all connected here. And so, hands down, any pelvic pain, rectal pain, tailbone pain, SI pain, pubic symphysis pain, essentially any pain in your body is going to cause a more stressed state of being, and it's going to exacerbate the tightness and constriction that's already there from the relaxin in pregnancy. We find a lot of people that grew up being athletes, or if you grew up being hyper flexible, those people tend to have a lot more tension through pelvic floor. If your hips feel like you can just never stretch them enough, again, that's usually because the pelvic floor is so tight and they are connected to your hip muscles, but it's no stretch really gets that pelvic floor. Sorry, the noise of the chair. But that no stretches really get the pelvic floor muscles, so it feels like that, you just can't get relief with hip stretches. Probably has a lot to do with the pelvic floor tension. So just some side notes of when to get it. Okay, let's go into breathing. This will be the final thing. We'll wrap with this and then whatever questions you guys have. Okay, breathing baby out. It's no different than pooping, same thing. But you're gonna stick with that breath pattern and you have to feel the opening. So say I'm deciding to deliver on my back, or deliver in standing, or in a flat back position here, then I want to start conditioning my pelvic floor to open here. This is a great labor position, getting the table or the bed at the hospital in this position, and then doing some nice belly breathing here to really open pelvic floor. You're here. Inhale and open, exhale and let it go. It's also impossible in heels to actually open up pelvic floor, so don't wear your heels. Bad today. So getting in whatever position that you can really foresee yourself laboring in and delivering in, and then seeing, okay, can I open my pelvic floor? Can I fully open? Allowing yourself the permission to touch your vaginal canal. Can you put a finger in here? Can you feel the opening? If you can sense an opening with every inhale, then you're going to be able to do that as baby's coming through birth canal. You'll start to feel pressure. The more rectal pressure you feel, you have to pass gas. You guys know you had children. You have to pass gas, or there's just a poop you can't hold in. You just keep breathing into that. And you're inhaling and opening, inhaling and opening. If you end up doing some pushing, how we teach the pushing is by doing some sounds with the pushing. So as I push, I want to keep my throat open so I'm not holding my breath. So if I hold my breath and push, That is a lot of intra-abdominal pressure going down. It's gonna make my prolapse tenfold worse. If I inhale, I have the natural pressure, but I've already started to relieve the pressure because my throat is open and I'm talking. So how we teach this is if I need to give a little more forceful push than just the breathing, I'm inhaling, keeping it open, and then as I begin the push, I'll exhale with a deep sound, or you can do a moo sound. The reason for a deep sound is to get your throat to open. The more your throat opens, the more your vagina opens. So play with this on the way home. Sing in a really high-pitched voice and see if you can feel the pelvic floor and the vagina tighten. And then sing, like, hit some really deep notes and see the pelvic floor open. And if you can get that sensation, that's good. That's the movement you want to feel. So I'm gonna just go through it again, okay? So say I'm breathing baby out. Maybe that's not enough. Baby's not getting fully out. Exhaling, let it go. Okay, I'm gonna give it a little bit more force of a push, but as I do that, my throat's staying open. I respond really well to a moo sound, so I'm gonna go with the moo. I'm gonna inhale. As I begin the push, I'll moo, and I can feel the descent, okay? So it's not pretty, but like it's the reality of how to get things to open and to generate force without increasing the pressure and helping prevent that injury. So we call it open glottis pushing, if you will. I think I'll leave it at that. There goes a little bit more complicated, and I think I definitely explain it in the book, but I think that's all you need to know in order to put it into practice. But moral of the story is if you leave here and all you do is two things. If you do your breathing 5 minutes every single day, get connected. I'm sorry, really it's 4 things. Start pooping every single day like this. Poop with the breath. Just force yourself to break the pattern of sitting, pushing the poop out, and moving on with your day. It's 3 breaths. It's so quick, but I don't know why it takes such discipline. I find myself even sometimes, I'm like, no, Allison, just relax. Sit here for a second. It's okay, you know? And I do this for a living, so I know it's hard. But just commit to the pooping, commit to the breathing, and then commit to that lower abdominal exercise. That 10 seconds, 10 times of just doing that isometric transverse abdominis contraction, and then get some pelvic floor work done. We have really specific protocols that we use to help open up the pelvic floor, but it is in your best interest. It's the best investment you can make in your future self, in my very not humble opinion. Just truly, just because I see it change lives every single day, and honestly, you'll read it in the book, but if I would have known when this is still very much the standard of people not working on the pelvic floor because someone is pregnant. That's what they still teach. You'll have a few PTs in the area that will do actual good internal manual therapy, but it's very few and far between. And that's what we specialize in, is truly opening up the pelvic floor. I wrote the book because I'm trying to change the way practitioners deliver this type of care, but the reality is most people don't, because they're not ever taught this in any school, they're not taught this in classes. I learned this on my own and developed these protocols because I knew how important it was, and I was a pelvic PT before I had my first kid, and I was like, I did everything like that I was supposed to do, but yet I end up with this massive tear, pushing for hours, bloodshot vessels, felt like I almost died because I held my breath for so long, and the reality is, like, everything I worked on pelvic floor wise wasn't enough because it didn't change the structure of the muscle. Yeah, I had the control, I could breathe, I could feel the opening, but I didn't have the opening, enough opening anyways. And so that's what stimulated this. That's why I started body motion physical therapy, in a nutshell. But anyways, so I'm very passionate about it, and I know it can just truly save your recovery, and you might not even realize it for the 5-10 years down the road, but it's in the 40s and 50s when we start seeing women and they're like, why didn't I just have this, like, why didn't no one tell me this, you know? And then we have these postpartum cases that come in, that, you know, you wish you could spread the word more. So, read the book. I hope you get some knowledge from that. If you want to come in we do free consults. So, and if you decide that you want to do pelvic floor PT, again, we're out of network, so we don't bill insurance directly, but we have a lot of payment plans and options. But I highly recommend just coming in for a consult, because even if you don't move forward with this, it will just get you that much more connected to your body. I can't hear all your personal stories today, but if you told me you were a dancer, or like, there's just different things in your histories that we would go through, to be able to be like, okay, this is probably your scenario, and here's what you need to do in order to change that or shift that. So we go through like your, essentially whatever you're willing to share past history-wise, from miscarriages to UTIs as a kid, to the sports you play, to how your body moves in life, and we just kind of explore that, and then that can give us a lot of information on how your pelvic floor is, and what you do for a living, even if you're on your feet or a hairdresser or whatever. So, yeah. Anyways, I could talk all day, but questions? Yes.
Yeah, so is the cervix connected to any tendons, or like how does that, is that what's causing that problem of it opening or like cooperating?
Of an opening. There is there are ligaments that attach to the cervix itself, and those attach to the sacrum. So it's called the uterosacral ligament. There's a bunch of ligaments around that area. So a lot of what, we don't actually manipulate the cervix when you're pregnant. We manipulate everything around the cervix, so that the cervix can then have the ability to
Because
open.
that's what makes sense, it being incompetent if it doesn't open, because the ligaments don't really cooperate, and the tendons and the muscles, all that stuff that's packaged in there. That's what it sounds
You mean
like.
during delivery itself?
Yes.
Yeah. When someone gets stuck at 6 centimeters or they're stuck at 5 centimeters, yeah, 100%. If there is restriction, there is no way that cervix can fully dilate.
Okay.
Yeah. So that's good insight. Yes. Are there any other questions? Yeah.
I've had a lot of people talk to me about the Kegels, which I guess is tightening of the
So
pelvic
glad
floor.
you talked about that. Yeah.
And this seems like you didn't mention it, and we were talking about loosening the pelvic floor. So
So
I'm just
funny.
like, where's that?
Yeah, so Kegels are archaic as all get out, and if someone tells you to do Kegels, like, run the other way, because they are not helpful when we're talking about really conditioning the pelvic floor. If you have range of motion and you can get the opening, every single time that you walk and your foot hits the ground, there is a reaction force that comes up your body that creates a Kegel.
Yeah.
A contraction.
I feel it too.
Yeah. So, so you don't have to actively do it.
Okay.
You really don't. And honestly, most people are so constricted or have some degree of tightness that them doing more constriction is not helping.
It's a counter.
Yeah.
Okay.
Creates more dysfunction. And like, let me just say this, like from a postpartum perspective, like don't let anyone sell you any toys that are gonna help you squeeze your pelvic floor, or any toys that, or not toys, like the chairs that you go sit on that like revitalize your pelvic floor, that create the stim that contracts it. Those create a lot more issues, because when you're postpartum, you might feel blown out. You just had a baby. The body is magical at healing. It will close back up, and all those little micro tears that occurred because the pelvic floor had to overstretch will create scar tissue and tension and tightness. And so your body is going to recoil. And then at 6 weeks postpartum, you're gonna need to go back to this breathing pattern of opening the pelvic floor, because the body is magical and is pulling your pelvis back together, because you just open the pelvis. And so even from a postpartum perspective, there's a lot better core exercises to be doing than Kegels themselves.
Cool.
So yes, I'm a little biased, but yes, when you want to get baby out of pelvis, don't squeeze. Yeah, great question.
Is pain right through here? Is that the round ligament pain that kind of comes down?
It could be,
Your
so
legs,
right
or-
in there, it could be round ligament, or it could be pubic symphysis pain.
Okay.
And so either way, getting pelvic floor work done will help.
Okay.
When I say pelvic floor work, but we also work a lot through the external pelvis and through the glutes, because as you're pregnant, you get about, I didn't say this, 6 to 7 millimeter separation here, and then when you deliver, you get up to 9 millimeter separation here. And when you get that separation, that can cause pain. And when the muscles are really tight, it increases that separation. So the thing to do to help take the pressure off of that is to help relieve the muscles of the glutes. Everything that attaches to the pelvis is what we're balancing with our birth prep protocols. So it's inside the pelvis and it's outside the pelvis. The only time we're not doing any internal work during pregnancy is if someone was on pelvic rest or they're bleeding, but it's way less aggressive than intercourse, so some physicians are fine with it. It's just, that would be the only time.
When you mentioned outside the pelvic floor, the iliacus and the psoas muscles,
Yes.
do you have any recommendations at this point in pregnancy?
For
what to
stretching
do?
those?
Like relax and
Yes.
so forth?
Yeah, I mean, I have a couple stretches in the book, but just doing a nice little lunge stretch can be really nice for that. Just in this position, keeping that foot forward, because as we're pregnant, our feet are gonna wanna go out, so trying to keep that foot forward and stretch and keep that lower abdominal tight when you're stretching that, just so you're not stretching into your ligaments, into your pubic symphysis.
Okay.
Yeah, good question. Yeah. Any others? No.
Your turn.
I just was wondering about like timing of contractions with the breath and how that usually works. So,
Yeah, great
because
question.
usually like, well, I've been told to hold my breath when I feel a contraction coming on, and then they're like, hold your breath and push, right?
Yeah.
Which is not what you're saying at all.
Yeah.
So then is it actually when you feel a contraction,
It's breathing into it.
breathe
Breathe
and
into
open?
it. Yeah, because when you feel it, a contraction actively happening, it's the uterus contracting, right?
Right.
Which is then supposed to open cervix. If you get the uterus contracting and then you put the diaphragm down on top of it, it's a boost. It's a boost for the uterus itself to give it a little bit more opening down at that cervix. So you're using your muscles actively to help open.
So what might like a birth look like during those last few pushes if someone's doing this technique
Yeah.
correctly? Is it like, I mean, they might be vocalizing, but it's much more,
It's
it
not
doesn't-
forced. It's not
forced, and it doesn't take
So-
like 2 hours longer,
No.
you know, like
Yeah.
it could take 20 minutes or something, it could be
Yeah.
quick, okay.
Really
It's-
quick. Yeah.
But you're letting your body do the work, you're
You're
like
letting
opening.
your body do the work, and your job is to keep it relaxed and open. Most people can't push and actually maintain the integrity of opening their pelvic floor. So that's another thing. It's like, and you'll have people like, if you've had babies before, like a lot of times they're telling you, okay, show me a practice push, and they're like, oh no, you're kind of squeezing, and you're like, so it's just like you can't
How do you-
train it in the birth room.
How can you kind of teach or empower your birth kind of team? Like,
Yeah.
I've given
I-
birth with midwives present, and I've
Yeah.
also done like OBs, and I'm sure they're receptive to this, but if
Yeah.
they aren't aware of,
Yeah.
Should be a physical therapist.
Did we have a video for
yeah.
I cannot remember. I had a video I made for Swedish for their name badges where it was like scan it when they come in so that you can like get the breathing patterns. But again, it's really hard to train once someone's in labor if you haven't already conditioned your pelvic floor. But to empower your team.
Right, because they
It's-
might be telling you,
Yeah, so
"Okay,
what
hold your
we
breath
have
and push,"
people
and
do
they're
is
like,
a
"No."
lot of people bring their partners to sessions. They might not in the beginning because they don't have control in the beginning, but then when we start to get closer to birth and get that control, then we empower the partners to do that. We just had, did you guys listen to it? I don't know if you listened, but I did a podcast 2 weeks ago. You have to listen to this one. It was with this woman named Cynthia, and she kind of tells you her first birth story, tells you her second birth story. Her husband did not, so she wasn't like supposed to have another vaginal delivery. They told her her grade 3 tear was just too massive, like you're gonna need a C-section, don't risk it. But she was like, no, like, and she put in all the work. Postpartum, we did like a whole fertility thing when she couldn't get pregnant, and then she came during pregnancy. And her husband was like, he was like, I just believed in you because you believed in yourself.
Mm-hmm.
And she was like, and she believed in herself because she was coming here and she like knew the tissue was changing. She knew she had this control. So he came to some sessions and then he was like, he had more belief in the process, So it's coming, getting your partner or whoever's gonna be in that birth room with you, if you can get them to be like, I'm gonna breathe my baby out. When I had my third, I had already developed this protocol. It's the only reason I had a third. I had to test it. And no, not really, because she's a lovely little baby, 3-year-old now. But she, I had my doula, and I kind of just gave her, like, I was like, you have to learn how to control your pelvic floor so I can, you know how to cue me when I'm in there, because my husband's like, he hates this stuff. Like, he just will sit on the couch. He's not an active birth partner. It's okay. He's good at other things. And so my doula, I told her and like trained her. I'm like, this is what I'm doing, and like it was really helpful because just in the final moments of like, she's like, no, just breathe, you know, and like open pelvic floor, and she had told the birth team, Allison's gonna breathe her baby out, just let her be, don't talk to her, kind of deal, and so that helped empower the room. Dr. Katrina, one of our PTs here, she just delivered. She commutes from Kitsap, and she delivered a year ago. Well, I guess Sawyer's 18 months, so 18 months. And she told them, she's like, I'm gonna breathe my baby out. She told her husband, I'm gonna breathe baby out. Like, this is what I do for a living. And they were yelling in her face, hold your breath in, push. And she was just like, she zenned it out. I was like so proud of her, right? But that's so hard to do, especially when they're doing that. So it's like, just as much as you can, educate the team. When they write on the board how you want to deliver your baby, breathe. I want to breathe my baby out. I'm not holding my breath. Just like all over the place, you know, and but you have to have that control of opening pelvic floor, because if you don't have that control, then that is going to make it a stickier process. So
like,
hopefully that's helpful.
Your pelvic floor is cement, like you talked about.
Yes.
You can't breathe the baby out. Basically.
Right, it's going to
Then
be,
you have to
that's
push.
going to take some manpower to really
Right.
try to get it. But when you're having to break through that kind of cement, you're having to use such intra-abdominal pressure to push, and not necessarily the push of the pelvic floor.
Right.
And that's where they're saying like breath hold and and just like push. You're using this pressure that's pushing your cervix down, your bladder, your rectum, your hemorrhoids, all of it. So, yeah.
Yeah, there's a lot of irony in healthcare.
Yeah. Yeah.
And yeah, because I went to the family birth center because I thought I was going into early labor at around 20 weeks.
Yeah.
Didn't happen, but
Good.
luckily,
Yeah.
and I already felt that tension coming from the doctors and the nurses as they were talking to me already, like, it's this way, no, you're not supposed to do this, you're supposed to do this and not that, and it was already starting to get like confusing for me.
Yeah. It's stressful. And like, at the end of the day, like, they're so overworked. Swedish First Hill is putting out 40 plus deliveries a day. Probably more now that Virginia Mason is closed. They don't have the time to coach you, support you, listen to you. So they're gonna, really truly, this is not made up. The best indication of your outcome for your birth is which hospital around here you walk into. Look up their C-section rates, look up their epidural rates, look up whatever is important to you. It's all posted publicly. And that's what is indicating what kind of birth you're gonna have. But I will say, to counteract that, the more empowered you are and just getting this information shows that you have a vested interest in your health, then you will change your outcome because of that. Truly read the book. It will hopefully have a positive impact. And all the stretches and exercises I give to help the pubic bone pain, to help the back pain, are good for opening the pelvis as well. So please feel like it's not just for those people with pain. Like, it is absolutely good as just like a baseline mobility exercise program too. So, and it's not too late being 30 weeks or however far along you are. We have people that come in at 38 weeks and we're like, they might be coming in 5 days a week to deliver, but no, not 5, but maybe 4. It just depends on how constricted the pelvic floor is, but in kind of their histories. But yeah, anyways, cool. Thanks for coming. If you want